Hi, I'm Debbie Wigley, the Learning Disability Liaison Nurse at Northampton General Hospital. This week is Learning Disability Awareness Week, but also Cervical Screening Week. It's important that everybody is able to access cancer screening, because by accessing cancer screening, it enables us to pick up early signs of cancer and to make sure that we're all well and healthy. Cancer screening can be difficult for some people, and particularly for our people with learning disabilities. There are often big words that are used that make it difficult for access, and also to know what's going to happen. That can be quite scary, but there are lots of reasonable adjustments that staff can make to help cancer screening more accessible for people with learning disabilities. And that's one of the reasons why we decided to develop this short film for people about cervical screening or smear test, to try and make you more aware and to make the whole thing a bit less scary for ladies with learning disability and for everybody really in the general population, so we can encourage more people to attend for cancer screening to make sure that you're all kept healthy and well. And if there is a cancer that's found when you have a cervical smear test, then it can be picked up early and you can receive the right treatment.
This film is about cervical screening. Women can get cancer of the cervix. The cervix is the entrance of your womb. It is inside your body at the top of your vagina. The womb is a round organ inside your body in the lower tummy area. It is where a baby grows if you are pregnant. The vagina is a passageway inside your body. It is part of a woman's sexual organs. The entrance to the vagina is between your legs. All women between the ages of 25 and 64 are asked to go for cervical screening. This used to be called a smear test. A cervical screening checks if your cervix is healthy. It checks for early signs that cancer might develop. This means you can have treatment to stop you getting cancer. There are other screening tests that look for the very early signs of cancer. You have screenings even if you feel well. It means cancer can be treated or stopped before it causes problems. You will be sent a letter inviting you for cervical screening. You will need to book this at your doctor's surgery. It is your choice if you go for cervical screening or not. It is a good way of checking you are healthy, and it can stop you getting cancer. If you are aged between 25 and 49, you will be invited to cervical screening every 3 years. If you are aged between 50 and 64, you will be invited to cervical screening every 5 years. The cervical screening test will be done by a nurse or doctor. If you think you have missed your letter, ask your doctor or nurse. If you are worried about having the test, tell your doctor or nurse. They will try to help. Tell them if you prefer a female nurse or doctor. You can bring someone to support you as well. What happens? The doctor or nurse will talk to you about your health. They will then ask you to take off your pants and then ask you to lie down on the bed in the room. The test should not hurt, but may be slightly uncomfortable. Try to relax and not worry. The doctor or nurse will use something called a speculum to open your vagina so that they can see your cervix. They will then use a small brush to take some cells from your cervix. Cells are the tiny building blocks that make up people's bodies. That's it. Then you can put on your clothes again. The cells that are on the brush will be sent for testing. You will be sent a letter with your results. This may take a few weeks. The letter may say that everything is okay. Sometimes you will be asked to have another test. This might be because the test did not work properly, or it might be because the test shows something is wrong. The second test will find out if you need treatment to stop you getting cancer. Ask for support to find out why you have to have another test. How Macmillan can help you. You can get support from the Macmillan support line. Call 0808 808 0000 7 days a week, 8 AM to 8 PM. You can visit the Macmillan website. Visit macmillan.org.uk for lots of information about cancer and living with cancer. You can visit a Macmillan Information Centre where you can talk to a cancer support specialist and get written information. Your nearest centres are at Northampton General Hospital in the Oncology Department, Area N on the ground floor, or at Kettering General Hospital, where you can visit opposite the Costa coffee shop, where you will see a green post. You can also visit local support groups. Find a group near you at macmillan.org.uk/support groups, or call the Macmillan support line. There is also a Macmillan online community where you can talk to other people in similar situations by visiting macmillan.org.uk/community.